You are reducing chronic homelessness this year by 30%.
Our police calls are down at our emergency shelter and our housing outcomes are up. It's not a one and done. You don't reset your policies to be low barrier and say, okay, done, we did that. This is everyday commitment. We can't help them if they're not here.
Right. If you just respect people,
yes,
they're going to return that respect. Instead, we treat homeless people like monster children or something. Then we wonder why it doesn't work.
In all of my work in homelessness, I've never met anyone that didn't want homelessness to end. Our reasons for wanting it can vary, and they can be compassionate or lack compassion, but we actually want the same thing. And when everybody starts pointing fingers at each other and the media becomes involved, all of the resources, all of the intention that should be focused on the ground become focused on the bureaucracy.
Today's guest is Danielle Neilson, Manager of Housing Stability for the City of St. Thomas. There's parts of this interview where she pushed back on what I was saying, and I learned a lot. They reduced homelessness, chronic homelessness, 30% this year. Watch or listen to find out how. You are reducing chronic homelessness this year by 30%.
I wish I could say that I single-handedly was doing that. That would be remarkable.
With the community of St. Thomas,
it
Elgin.
takes a whole community.
Yeah.
Yes, absolutely, Mark. And I think we hear that often when we talk about work to serve people and support people and create healthier pathways and improve life.
Yeah.
It truly takes a community. And I can share with you with a lot of pride that St. Thomas is that kind of community.
Well, it's so important that you just kind of corrected me a little bit. And I'm glad you did, because I have been talking about community-wide systems. Because, you know, we have been pushing housing first, housing first, housing first, housing first. And then there's the battle between housing and shelters and all this other. It takes it all. Affordable housing, eviction prevention, outreach, shelters, and supportive housing. It's all of it.
Truly. Yes.
And it's a community.
It is a community.
So I love that you started like that.
Thank you, Mark. Yeah, I've never seen anything like it in my career so far, and I recognize that that's a limited scope related to, you know, only a few communities, and not to say that there isn't tremendous work happening out of the previous communities that I worked for. But in St. Thomas, Elgin, it's not even just your usual suspects. So an example I can share with you is that our public library is our partner. They recognize that people experiencing homelessness often have poor sleep hygiene, and so they'll let people book out study rooms for uninterrupted sleep periods.
Whoa, wait. You're because I know of libraries that have social workers. I have libraries, because you even said, you know, hygiene. So I thought you were going, oh, they give them a hygiene kit. They allow them to book a room to sleep?
They sure do.
That is awesome.
It's just one of so many examples. Our Chamber of Commerce this summer, for example, came forward and said, homelessness issues, social issues are business issues, so what can we do? And they held an event in St. Thomas where they invited all Ontario Chambers of Commerce to come and learn and talk about homelessness and to hear about the St. Thomas response and why it's working. It's literally everyone. It's like all the cool kids are doing it now in St. Thomas Elgin. Everybody wants to be a part of it. Justice is at the table, health is at the table, and just a really beautiful community ready to do this hard work.
How do you get everybody at the table? That's, from my experience, the hardest part.
It is really difficult, and there's so many moving parts to it, but I can share with you, and again, this is all through my lens on the work. I've been with this community for 4 years, this month actually, and what I would share with you is that it starts with political will. Our mayor and our council are unanimous in their efforts to prioritize supportive affordable housing and to reach a functional end to homelessness, and they are doing their part to ensure that us as service providers and as public administration are able to do this really hard work.
Were they elected that way, or was there a change?
I want to say all of them. I feel like I can say all of them did include this in their platform through the election process.
And they got elected and won.
They did, yes.
Wow.
Yes.
And hear that, politicians? Politicians need to run on a platform of housing and ending homelessness.
Agreed. And it needs to be more than just the platform. You then need to see the action and the output.
Right.
And that's certainly what
love the
we're
way you
seeing
think.
in St. Thomas.
Yes. So the mayor and city council are supportive?
Yes,
And then
completely.
what?
There's a number of things that they do. One thing that I find relieving in doing this work in St. Thomas Elgin is that they trust their public administration. They feel confident that they've hired people who understand the complexities of homelessness and can create plans to move the community forward, and they get out of the way instead of getting in the way. The other ways that our politicians support us is that they give our naysayers and our NIMBYism folks very little airtime. They focus on the good stories happening in St. Thomas, and so I can share with you as a community, one of the things that I've learned, people have known this for a long time, but there's power in storytelling. Yeah. And St. Thomas Elgin tells its story, and it's a beautiful one. And it's not that we're perfect, we're far from it. And it's not that our work is done, we're just getting started, but we're moving the dial in the right direction, and we're all rowing the boat at the same time.
We had a brief conversation, and you're very authentic.
Thank you.
You said, yeah, that's this year, but it fluctuates. Instead of, we're ending homelessness, you said, no, we're having some good success this year,
yes,
but it could go down, it could go up, and that's the battle, that's the work.
Yep, agreed. And we watch our data very closely. So we see that fluctuation on a daily basis, a weekly basis, a monthly basis. And we use that to inform our plans and our decision making. Our goal, and I truly believe we will reach it, is get to a place where we have more resources than need so that we can not only functionally end homelessness, but then focus our efforts on sustaining it.
Right.
And again, it gets back to that whole community. This is not something that any single hand can take responsibility for. And it takes other things that I find we often don't make a lot of time to talk about, like
criminalization is getting worse, support for real solutions that will prevent and solve homelessness are disappearing. We have a perfect storm of homelessness coming. Our work has never been more important, but we need you. Please visit invisiblepeople.tv/donate and become part of the solution. We need you now more than ever. And if you can, please become a monthly donor.
And it takes other things that I find we often don't make a lot of time to talk about, like love and resilience. And I know that's a word that some people love and some people don't love it so much, but these things need to be built into your culture. And for me, even when we talk about love, there's an element of love that includes accountability. And like in my years working with people experiencing homelessness, which I feel like is a privilege, truly, they've enriched my heart and my mind in ways that I could probably never repay them for. But one of the things that I've learned, and I share that with other people, is that people experiencing homelessness are not hopeless and they are not helpless, and they should not be treated as either. And I feel like that's alive and well in St. Thomas, where when I think about even how we include the voice of lived experience or living experience, not that we don't have measures in place where people are at our tables and part of discussions, but it's bigger than that. Like the people who access our emergency shelter inform the way that policies and practices are put in place in our emergency shelter. And we've moved to true low barrier emergency shelter operations. It's the same in street outreach. It's complicated work, especially supporting people who are experiencing unsheltered homelessness. Our staff bring back their voice. They tell us what their challenges are. They tell us what their needs are. And then as a community, we look to see how we can continue rowing the boat in the same direction.
You mentioned a word, culture. And we saw this in Finland, that they had a culture to solve homelessness. I mean, it was their culture. They literally wanted to improve, and they built in systems, feedback systems, so that they could improve, right? It wasn't about a power struggle or who's doing bad or who's doing wrong. It's we need the information so we can get better.
Yes.
And it sounds like you're doing the same thing.
Yes.
That you have developed a culture. So how do you develop a culture like that? Love, resilience?
A lot of it is education. And I will say that I think part of it in St. Thomas Elgin is our size. So combined, we have a small urban setting of about 50,000 people.
Yeah.
And then the rest of the area is a large, sprawling rural area. So together it's about 100,000 people. And I think there's something to that size. Not to say that what we're doing couldn't be upscaled or downscaled to match. But I think a lot of it is about education and being able to speak to people in a way where they can receive the information. Some key messages that I often start with. One is that in all of my work in homelessness, I've never met anyone that didn't want homelessness to end. Our reasons for wanting it can vary, and they can be compassionate or lack compassion, but we actually want the same thing. And when you can normalize a conversation, oh, good. I'm flattered, Mark. That's wonderful. But when you can normalize a conversation and sort of deflate the heat when you get into the mix of what's happening for people, and that this can happen to anyone. And I provide examples from my time working in youth homelessness, which really opened my eyes to that, into all populations of homelessness. No one's protected from an experience of homelessness, and that also can normalize a conversation. And when you can sort of debunk some of that and deflate the anger, then you can get to the real good stuff about who people experiencing homelessness are. That some of them are my favorite people on earth.
Oh my gosh. Yeah, I have a problem. I would prefer to sit on the sidewalk. Now, I wish they weren't homeless, but I prefer to sit outside and talk to a group of homeless people more than I would want to sit in a boardroom and talk to a bunch of executives. And it's a serious problem. And I don't know if I'll ever find a cure.
I don't think you should.
I agree with you.
I think that you probably know the same riches that I've had the opportunity to witness, and the level of strength and creativity and humor and survival, like it's unmatched to any other group or population that I've spent time with.
The tenacity and the tolerance is really so gorgeous to me, because you will have homeless people. Some might be of different races, different sexual orientation, different religions. Some might be disabled. And yes, there's problems, right? You put humans together, there's problems. Look at the United States government. There's problems, right? There's more tolerance in the homeless community. There's more tolerance that I see extended to others. Compare that to the boardroom, mostly white people, mostly white men. And if somebody was disabled or maybe not like everybody, they wouldn't be sitting at the board table, right? So that's why I just adore homeless people.
They themselves have endured so much, and they've been overlooked, and they haven't been heard, and people will often walk by and not make eye contact.
Yeah.
And then when you do, and you really see someone, what always amazes me is to have an understanding of what they've suffered, and that there's still a sparkle in their eye, and how grateful they are just to have been seen. Yeah, it inspires me and breaks my heart, probably is the right way to say it. But
So you were talking about functional zero.
Yes.
So that means you have to be part of the Built for Zero.
Yes, we are.
Tell me about that.
Yeah, it's been
Tim will be
a great
happy.
journey. Oh, good.
Then we segued into this.
Yes, we're good friends with our Built for Zero Canada partners. So St. Thomas Elgin wanted to lean into best practices and wanted to set a goal for reaching functional zero. And so we became a Built for Zero community in May of 2020. And they've been incredible partners. Since then, we've reached a number of different milestones with them, starting with some of the early lower hanging fruit, like achieving quality by name list so that we could use our data to help us make decisions. We've had a couple of reductions before this most notable one this spring, but in addition to that, Built for Zero also supported us in our efforts to become Canada's second community to end or reach functional zero, I should say, for veterans homelessness. So that was last year and was very exciting. And through their support and best practices, earlier this year, they confirmed us as having reached that 30% reduction in chronic homelessness.
So you did something a couple of times I also heard it from the stage today that I wish people in America would do, because they just say, oh, we ended veterans homelessness. You all say we functionally, or you
Yes.
bring in the functional zero.
Yes.
Right? And communication wise, people don't understand what that is, but you're not just saying you ended homelessness. And I think that is misleading and confusing to the public. People might not know what functional zero is.
Sure.
Could you explain it?
Yeah, I'm happy to unpack that with you. So I think right now in our current crisis related to homelessness and housing, we have work ahead of us to sort of relieve the bottleneck that has been caused by decades of system failure. What we know from doing that work is that we can't ever confirm or prevent that an occurrence of homelessness will never happen again. Right. That would be an impossible statement. Those are the things that cause homelessness are largely out of our control. So a functional end to homelessness essentially means that you've reached a place, again, like I said earlier, where you have more resources than need, which supports a community in ensuring that when an occurrence of homelessness does happen, it's rare, brief, and non-reoccurring. I think that when we do match resources to the bottleneck of need that exists right now, and we can start to focus on prevention, we'll get closer to what an end to homelessness will look like, but we'll never have a magic wand that suggests that no one ever again, no matter what the population is, will ever experience homelessness. The causes are too complex.
So earlier you started with the library, and it was just, I apologize, but it was so amazing to me that they're allowing people to sleep. So what is the rest of how your community is working to prevent and solve homelessness?
There's so much. And the library is such a touching example. So I do take every opportunity I can to share that. And
I'm glad you did.
I'll share more with you, but just a little bit more on the library, because I think this really adds to the culture that exists in St. Thomas. They didn't do that because we asked them to. They actually reached out to my office to have a discussion because they said, we want an inclusive library for everyone. We are experiencing some challenging behaviors that make it hard to have someone experiencing homelessness in the library and a 2-year-old in the library. Can you help us figure out some solutions? And so we started to engage and do good work with them. They'd already started the sleeping part, which was amazing. Now we have one of our staff from social services there half a day a week to help sort of keep that culture going. And it's just a beautiful thing. But it is one of many. The usual suspects in homelessness are street outreach folks, our emergency shelter, our supportive housing. They all, again, lean into best practices. There are solutions that have been known to this sector for a very long time. And people who have known them, I know that you and Ian DeYoung do a lot of work together, and he knew this stuff back then. Right. But he was one of very few who were promoting it and putting it, and it was at a time where the rest of us had all complicated it. The solutions to homelessness weren't housing, they were life skills, and they were big shelters. And so fast forward, all of those usual suspects are leaning into best practices. We have full alignment in our community that housing with supports as needed is the only solution to homelessness. That's not to say that other services aren't required, but that shared belief is part of our culture, and it really helps move the dial, and it makes room for other partnerships to come to life. In our community, our Central Community Health Center, largely led through Dr. Mai and Shelley, are operating a low-barrier Sublocade program. I'm not sure how well.
That?
So Sublocade is a treatment option for opioid use disorder.
Okay.
It's delivered through injection, and it lasts for 30 days. And the way that it works is that it reduces cravings and the withdrawal symptoms of opioid use disorder.
Right.
And there are a lot of components around Sublocade that are showing to be quite an effective treatment option. Maybe I'll encourage your viewers to give that a Google. So Dr. Mai and Shelley understood that this medication might really work for our population of people experiencing homelessness, but typically it's administered in a way where abstinence is required. And to confirm that you're sustaining abstinence, you need to give urine samples. And to give your urine samples, you have to have regular medical appointments where you're coming into the clinic. All three are unreasonable for some people experiencing homelessness. And instead of complicating things, they just remove them.
Right.
They just said, we're going to operate this program and we're not going to require abstinence and we're not going to require urine samples. And in fact, we're going to come to you. So they are in our shelter. They are in our supportive housing and it's working. The rates around overdoses and deaths related to overdoses in our community has dropped substantially. Another example I can share with you is that our St. Thomas Police Service, who are really dedicated to doing good community work, have created a new division called our Community Resource Unit, where they're hiring folks that we refer to lovingly in our community as our special constables. And they're coming to St. Thomas Police Services with a diverse background in social services and healthcare and nursing. And they're on our streets every day, not doing typical or core police work. Their job is to work with our local downtown businesses, engage our vulnerable population, build relationship, and help our system and our vulnerable people navigate healthier pathways. And it's remarkable.
You didn't go by the rule. You reduced the bureaucracy.
Yes.
And bureaucracy kills.
It can.
And I have been saying this forever and ever and ever. Now, something else you mentioned was low barrier shelters. Mm-hmm. So what does that look like in your community?
It's been probably a year to 2 year long process to truly dig into what it means to be a low barrier shelter, like authentically. The shelter has incredible leadership that believes that that is the way, the only way to offer emergency shelter services to people who are living with lots of complexities. And it's ongoing work. I'll give you more details, but one of the things I love about their leadership team is that it's not a one and done. You don't reset your policies to be low barrier and say, okay, done, we did that. This is everyday commitment. Revisiting your policies and your rules and your restrictions and determining, is it appropriate for the population? Let's have a discussion as a team. And then is it appropriate for the person? So an example is they've moved away from shelter restrictions. There are some situations where it's required because it's heavily based in safety, but they've moved more towards shelter breaks. So if things get heated between someone, let's say a shelter guest and a staff member, they might say, go for a walk, come back in 2 hours. And that typically will work. And in situations like that, they might say, okay, well, that works well for Mark. Mark is good to take a 2-hour cool out, but Danielle loses her mind when we tell her to go for a walk for 2 hours. So why don't we try 30 minutes with her and see if that changes things and if that might help course correct the behavior. Yeah. So it's a daily commitment. It's really looking at the realities of serving this population.
So
if
listening
you want them
to
come
people
inside.
and
Yes.
being willing to change the rules.
Yes.
Because especially the rules that become barriers.
Absolutely. And being realistic about the population you want to serve.
So usually in the framework of low barrier, it is that there's low barriers to entry, right? Mm-hmm. That, the person could still be using drugs, for example.
Yep.
But what you're saying is low barrier, there's low barrier to the stupid ass rules.
To everything, Mark.
I love it.
Yep, to everything. And, when we get a lot of calls from other communities across Canada into the States and even further at this point, and they want to know, what are you guys doing over there? And they want to know more about the shelter. And Brian, who's the executive director, he has shared with me that sometimes he senses fear or anxiety from people. Like, if we do that, then all chaos is going to ensue. Yeah. That's not been our experience. Our police calls are down at our emergency shelter, and our housing outcomes are up.
Whoa. Police calls down, housing outcomes up.
You got it. And their philosophy is, we can't help them if they're not here.
Right. And so I've always believed if you just respect people,
yes,
they're going to return that respect. Mm-hmm. Instead, we treat homeless people like monster children or something. Then we wonder why it doesn't work.
Yeah, and then we perpetuate those stereotypes too, right? And that misunderstanding of who it is that we're trying to help. And probably when I speak, I make it sound like a haven. Our shelter works hard every day. Yeah. There are things that come up every day, all day. Yeah. It's full. People are living with a lot of challenges in their life, but there is compassion and commitment. That is unwavering amongst the staff team that their leadership has brought together. They work in really close partnership with us as their municipal partner and others. That's collaboration is huge in our municipality.
How do other communities do what you're doing? What would you're talking to them? You're talking to some other stakeholder in another community that says, oh, that's all great. Where do I start? How do I do that?
How do I do it? I mean, you need to create buy-in. And sometimes that starts with looking at who are your early adapters? Who do you know is going to buy into this vision for a community? And that's it too. Like, you do need to have a vision that you're connecting all of this work to, so that you're, again, rowing the boat in the same direction. And then I suppose it's important to start somewhere. Like, if you can't do all best practices all at the same time, which is what you need to do, start somewhere, anywhere, but that needs to be the goal. Our community's presentation tomorrow, for example, I'll list out some of the best practice, maybe all of the best practices that we're working with in St. Thomas Elgin, and I'll include in my speaking notes that you can't pick and choose. Like, if you actually want to move the dial on homelessness, it requires a commitment to all best practices across all stakeholders, and for your entire community to see themselves as responsible and part of the solution, and asking themselves how they can help. And if you can't help, then just don't get in the way. Even advocates who, for the very best of intentions, want to see change happening in their community, and they want to maybe disrupt things, sometimes it doesn't get you the outcome that you were hoping for. And when everybody starts pointing fingers at each other and the media becomes involved, all of the resources, all of the intention that should be focused on the ground become focused on the bureaucracy, the policies, the community voice, the narrative that's now being told for a community that may not even be accurate. And it can take away from the really good work. And I don't mean to suggest that disruption doesn't have a role to play. I just think it's helpful if everyone's mindful, if even the media is mindful. Like, are you glamorizing homelessness? Are you writing your article hoping to get the most attention, or are you writing it because you want to inform the community on the issue or what's
tough
happening?
Because media is often driven by the most intention.
I know. Yep.
So
It's
that's
tough.
a tough one.
It is. I'd love to know sort of what motivated you to start.
You don't know my story.
No.
Many years ago, I had a great job in the television industry, television syndication, Wheel of Fortune, Jeopardy, Married with Children. And
Really?
I ended up homeless. I ended up homeless on Hollywood Boulevard. And I rebuilt my life back to a 3-bedroom house and a new car and pool in the backyard and a cushy marketing job. And in 2008, the economy tanked. And I lost everything again except my sobriety. So right around 19 months of unemployment, I mean, not consecutive. I would get a job and get laid off and get a job and get laid off. It was a really dark time. I grabbed a camera and I went out and started interviewing homeless people. And I want to tell you that I wanted to change the world, but that wouldn't be the truth. I was just giving myself purpose. I needed a reason to get up in the morning. Now, there's some thought and passion behind it. I saw two things. There's a direct connection to how the public views homelessness and policy change. I saw the harmful beliefs that people hold on to about homelessness. Then there's also a disconnection between leaders in the homeless sector and politicians and homeless people. Put all of it together. You asked earlier, have I ever been to Canada?
Yes.
Do you remember the Calgary Homeless Foundation?
I do.
Tim was the CEO. He asked me to go to 24 cities in Canada to have every mayor sign a proclamation to start the Canadian Alliance to End Homelessness.
No way.
Yeah.
That's
So
cool.
I actually was living upstate New York, taking care of my mom, about 4 hours away from here. So I was spending more time in Toronto and different places. But I remember I went out with outreach here in Ottawa. I always come in a little early and do some interviews. And I interviewed a homeless youth, a young kid, and he died of an overdose shortly after the interview.
Oh, my.
And that's always stuck with me. So I haven't, I'm going to get emotional. I haven't talked about it. I mean, this trip I've talked about a lot of things. That has been on the back of my head, the memory of being with him, because if I remember right, the outreach team went and got him boots because he needed boots. Meeting this homeless youth who then passed away from an overdose really has stuck with me, this event, because I'm remembering it. And with the right supports, with harm reduction, with more shelters or housing, his death could have been avoided. I don't know the exact number, but the deputy mayor this morning said Ottawa, their shelter system is 426% over capacity, right?
Yeah, we need to do better.
Yes, we do.
I also just want to say thank you, not for remembering that event, but for remembering him, because that means his death wasn't purposeless.
I adore the Canadian line to end homelessness.
Oh, good. Me too.
Yeah. So
That's wonderful. Well, thank you for the opportunity, Mark. It was a privilege to get to meet you and to share our story.
You've been wonderful.
Oh, thank you.
Thank you for joining
too.
us.